Hi, this is Dr. Kelly here at Uptown Chiropractic, and I have also Dr. J here as well, and we're going to go through the Webster technique protocol. This is a protocol that we use through pregnancy, and if you don't know what that is, Dr. J is going to show you. I'm going to be the patient. Obviously, I am well equipped for this, so we're going to let Jay take over, and I'll assume a patient role. So.
Awesome. Obviously, when the patient comes in, we're going to do a full detailed history and physical and scan to see what's going on. But once we're ready to adjust and assess the patient, what we'll do, you can see we have pregnancy pillows. There's actually a hole cut in the center. And, usually by 30 plus weeks, we'll double stack the pillows and let the air out so there's a nice big area for baby to be comfortably resting in. So we'll get Kelly to lie down gently and slowly. I put the headrest up there for her too so she can be comfortable, and typically I'll lift the leg piece up a little bit just to make things as comfortable as possible for her. So the first thing we want to do is check out her alignment, because really pelvic misalignment can lead to basically lack of real estate in the pelvis for the baby to freely move. So never think of the Webster technique as a moving baby technique. It has nothing to do with that. It has to do with realigning the pelvis, taking any tension out of the hips and round ligaments to allow baby to naturally move on their own in the right position. So we're going to check her leg length to start. Her legs are even. She's well adjusted. That's awesome. And then the next part of this is we're going to bring both her heels to her pelvis to see if there's any abnormal tension one side to the other. For Kelly today, it's her left side that's just slightly in more tension than her right side. So that's the left side positive Webster. So basically, I'll check her pelvis at this side, right in her sacrum, and what I'm finding is that her left sacrum is in fact locked up, causing that tension through there. So my job would be to assess that, and then we do some light pelvic adjusting through there to get that restored back to normal function and better alignment. And then I would recheck this, and it's cleared, which is wonderful. And then we would check her piriformis muscles to make sure they're balanced out. We'll also check her sacrotuberous ligaments to make sure they're balanced out, just so she holds her adjustment better. And from there, I would check the rest of her spine to make sure it's moving like it should. Wonderful. And once all that's clear, we'd get the patient, and Kelly in this instance, to go on her back. So she would get up off the table. We take away the pillows, lower that down, and then legs straight out, and I can lower this a little bit as well. Perfect. Next up here, I'll be looking at her head and neck posture too as well, and check any areas of misalignment through there, make sure we clear those out as well. And then I would get her arms up, and this would be the arm test part of the Webster technique, to see if there's symmetry and balance through the arms. She is balanced, but if one side was tighter than the other, I would go to that shorter side's hip and do some gentle hip mobilization through there. Like that. And we'd also check the pubic bone to see what's going on there as well. And then we'd also check her round ligaments to see if there's any tension through there. If there is tension on one side or the other, typically, we'll do a little gentle pressure on that area, very gentle, just to help that round ligament release. When that happens, between that and the pelvic balance through there, we see that baby is able to freely move better, and often, it's a very good success rate with the Webster technique on allowing babies to move into the right position. Anywhere from, 70 to 85% success rate on allowing babies to turn in their natural position without, we're not touching the belly, but basically we're optimizing the balance between the pelvis and the round ligaments, etc. Awesome, so Kelly's all set. So we can help her up. And obviously the sooner we get at this as well, the sooner we check during pregnancy, the more optimized the position of the pelvis, the better. Sometimes we get a late call, 36 weeks pregnant, and I'd love to get in to get checked. We can still help, but the sooner on in the pregnancy, the better for sure.
Also with pelvic dysfunction or misalignment, the big thing that it would cause is a lot of discomfort through pregnancy. So some of your common complaints like low back pain, sciatica, pubic bone pain, they all can be relative or related to a misalignment in the spine there that's not allowing the pelvis to function properly. So a lot of those ailments, there's usually a root cause of that. So that's something that we have to address as well, and that just goes along with the protocol. So
yeah, and typically women that come in during pregnancy and post-pregnancy, they notice that during pregnancy they're a lot more comfortable, they feel better, and during labor it's often much easier, and after the recovery time is much quicker. So chiropractic for pregnancy is awesome.
Super safe, gentle. We didn't show any real adjustments there, but it's super comfortable. I that's one thing that's very commonly expressed over and over. So, yeah.
Awesome. Hope you enjoy. Thanks.